Hello, my name is Dr. Danny Rahal. I'm a professor at the University of California, Santa Cruz, and today I'll be talking about an article that I've had published in Family Process with my co-authors, Dr. Andrew Fuligni and Dr. Michael Irwin from the University of California, Los Angeles. So having regular family meals can be a family ritual that benefits children and adolescents in multiple ways by imparting stability in the home, promoting a shared family identity, and providing a time for parents to monitor their youth, as well as for them to discuss their daily experiences and challenges together. For instance, children have more frequent family meals, also tend to have better eating habits. Another health outcome of interest is substance use. However, research has been mixed regarding whether having frequent family meals is related to substance use for youth during adolescence, a period of high risk for substance use. Specifically, some studies suggest that family meals may be related to lower substance use for girls, but not for boys. Studies have also found inconsistent results regarding the mechanisms by which family meals relate to substance use, with some studies suggesting that having more frequent family meals benefit youth by promoting family relationships and family cohesion, and others suggest that family meals may uniquely benefit youth, even after accounting for these other factors. Therefore, the present study tested whether family meals relate to substance use with respect to substance use count and frequency during high school, whether associations differ by gender, and whether other family-related variables such as family cohesion and time spent together can explain these associations between family meal frequency and substance use. We leverage an existing cross-sectional data set of a community sample of 316 adolescents. They were generally ages 15 to 16, with an even breakdown between male and female participants. Participants were recruited from the greater Los Angeles area and were primarily from Latine, Asian American, and European American backgrounds. Across 15 days, they reported whether they had a family meal, got along with parents, and spent leisure time with family at the end of each day. This protocol allows us to get a day-by-day assessment of how frequently children are having family meals, which tends to be a little bit more accurate than a retrospective report of how often they've had meals in the past week or in the past month. They also completed a psychosocial survey in which they reported the number of substances they have ever used, which is a measure of overall substance use count, or lifetime substance use count. They also reported the frequency of substance use with respect to the past year, use of alcohol, use of cannabis, and past month use of cigarettes. Using items from the Youth Risk Behavior Surveillance System, or YARBIS, they then completed measures of parental support and family cohesion. We found a consistent pattern that having more frequent family meals was related to lower substance use count and less frequent alcohol, cannabis, and cigarette use. These associations were significant even after controlling for other family-related variables, suggesting that there may be something unique about family meals specifically, as opposed to these other aspects of family relationships. Differences by gender may have emerged for varied reasons. Girls tend to be more involved in preparing the family meal and disclosing details about their days to their parents compared to boys. So studies can assess whether having boys more involved in family meals may actually reduce their substance use risk. Family meals can also signal to their children that they're invested in their experiences, and discussions at family time can promote emotion regulation. Girls tend to report motives to use as a means of coping more frequently than boys do, so girls might benefit more from having frequent family meals as a result. They also tend to be more relational and sensitive to positive and negative family dynamics and experiences compared to male adolescents. Now, it's important to note that the study was cross-sectional, so aspects of family meals earlier in childhood may have impacted the present results. It's also possible that past year substance use can impact adolescents' daily experiences and how they interact with their families, although this seems unlikely given the really low rates of use across the sample. Taken together, more frequent family meals in high school may reduce substance use risk for female adolescents, and interventions could consider promoting family meals in addition to other positive family values. Still, prospective and intervention studies are needed to truly determine the mechanisms by which frequent family meals can impact children's substance use, as well as identify means of reducing substance use risk among boys.